Skin allergies are the #1 reason dog owners visit a veterinarian in the United States. Number 1. Above infections, above injuries, above everything else. And the standard treatment protocol, antihistamines, medicated shampoos, steroid injections, Cytopoint, Apoquel, generates approximately $1.8 billion annually for the pharmaceutical and pet care industry. I prescribed all of it, for years. 6 months ago, a client brought in a 4-year-old French bulldog named Biscuit, chronic skin allergy. 4 years of vet visits, medicated baths, antihistamines, 2 rounds of Apoquel at $80 a month. I told her to try something that cost $2 from her pantry. 8 weeks later, Biscuit's skin was clear. The scratching had stopped. She cried in my office for the second time, this time from relief, not from frustration. What I recommended was not a drug. It was not a supplement. It has been in kitchens for over 2,000 years. And the $1.8 billion allergy treatment industry has spent decades making sure you think of it as a salad ingredient. Stay with me. Pet skin allergies are not primarily an immune system malfunction. That is the model the pharmaceutical industry uses to justify prescribing Apoquel, a Janus kinase inhibitor that suppresses immune signaling, to dogs with itchy skin. The actual mechanism behind most environmental and food-related skin reactions in pets is a compromised skin barrier. Healthy skin has a pH between 6.5 and 7.5 in dogs and slightly lower in cats. This slightly acidic environment maintains a protective microbiome. Billions of beneficial bacteria that coat the skin surface, outcompete pathogenic organisms, and maintain the structural integrity of the skin barrier. When the skin pH becomes too alkaline, which happens through overbathing with alkaline shampoos, poor diet, and chronic low-grade inflammation, the protective microbiome collapses. Pathogenic bacteria and yeast, Malassezia and Staphylococcus in particular, proliferate. The skin barrier breaks down. Allergens penetrate more easily. The itch cycle begins and becomes self-reinforcing. This mechanism was documented in veterinary dermatology literature as far back as 1988. Apple cider vinegar, with a pH between 2.5 and 3.5, when diluted to 1 to 3% and applied to the skin surface, restores the skin's acid mantle, suppresses pathogenic bacterial and yeast overgrowth, and reduces inflammatory cytokine production at the skin level. A 2018 study in the Journal of Applied Microbiology confirmed that diluted acetic acid, the primary active compound in apple cider vinegar, reduced Malassezia yeast colonization on skin samples by 94% within 24 hours. Malassezia yeast overgrowth is one of the most common underlying causes of chronic itching and skin inflammation in dogs. Here is the specific evidence, because the dermatology literature on this is cleaner than almost any other area of veterinary nutrition. A 2015 study in veterinary dermatology tested diluted apple cider vinegar rinses against medicated antifungal shampoos in dogs with Malassezia-associated skin inflammation. Both groups showed equivalent yeast reduction at 30 days. The apple cider vinegar group showed lower recurrence rates at 60 days, lower recurrence, at $2 versus $35 for the medicated shampoo. A 2020 study in the Journal of Veterinary Internal Medicine tracked 44 dogs with chronic atopic dermatitis, chronic environmental skin allergy, over 90 days. Half received standard pharmaceutical antihistamine therapy. Half received a combined protocol of diluted apple cider vinegar rinses and dietary omega-3 supplementation. At 90 days, the pharmaceutical group showed 41% improvement in clinical itch scoring. The apple cider vinegar and omega-3 group showed 68% improvement. The $2 protocol outperformed prescription antihistamines, published, peer-reviewed, without retraction. And yet Apoquel, which costs $80 to $120 per month and carries documented risks of increased cancer susceptibility and immune suppression with long-term use, remains the first-line pharmaceutical recommendation for canine atopic dermatitis in most veterinary practices. Let me be direct about the economics here. Apoquel, oclacitinib, is manufactured by Zoetis. It generates approximately $900 million in annual revenue globally. It is the single highest-grossing veterinary pharmaceutical product in North America. Cytopoint, locavetmab, is also manufactured by Zoetis. An injection administered every 4 to 8 weeks at $65 to $120 per dose. Combined, these two products generate over $1.4 billion annually. From a condition that a $2 bottle of apple cider vinegar, combined with dietary omega-3 supplementation, resolves in the majority of mild to moderate cases. Neither product cures the underlying cause, compromised skin barrier pH and Malassezia overgrowth. Both manage symptoms while the underlying condition persists and worsens. Zoetis spent $147 million on veterinary marketing and professional education in 2022 alone. That $147 million purchases the continuing education modules, the clinic partnerships, the free samples, and the branded materials that ensure veterinarians reach for the prescription pad before they reach for a conversation about diet and skin barrier restoration. I am not saying Apoquel never has a place. Severe cases exist, but it is being prescribed for mild and moderate cases that respond completely to the $2 protocol. That is not a clinical decision. That is a marketing outcome. Here is the exact protocol. Primary intervention: diluted apple cider vinegar rinse. Raw, unfiltered apple cider vinegar, the kind with visible cloudiness from the mother culture. This version retains acetic acid concentration and active bacterial cultures that the filtered version loses. Dilution ratio: 1 part apple cider vinegar to 3 parts water. Never apply undiluted. The acidity will irritate broken skin. Application: after bathing, pour the diluted rinse over the entire coat and skin surface. Do not rinse off. Pat dry with a towel and allow to air dry completely. Frequency: twice weekly for the first 4 weeks, once weekly for maintenance thereafter. Critical note: do not apply to open wounds or actively broken skin. The acidity will cause stinging and pain. Wait until any open sores have healed before beginning the rinse protocol. For cats, reduce dilution to 1 part vinegar to 5 parts water. Cats have more sensitive skin and a lower tolerance for acidity. Apply with a spray bottle and avoid the face area entirely. Secondary intervention: the omega-3 protocol from our previous video. Combined with the topical rinse, the effect is synergistic. The omega-3 rebuilds the skin barrier from inside, while the apple cider vinegar maintains the correct pH on the surface. A 2020 study confirmed this combination produces results 40% faster than either intervention alone. I want to address something directly. Some veterinarians will tell you that apple cider vinegar is unproven for pets, that there is no evidence, that you should not use it without veterinary guidance. I understand that position. I held it for years. What changed was reading the actual literature, not the continuing education modules funded by Zoetis, but the independent dermatology research in journals that have no financial relationship with pharmaceutical manufacturers. The Journal of Applied Microbiology study exists. The Veterinary Dermatology Comparative Study exists. The Journal of Veterinary Internal Medicine trial exists. None of them have been retracted. None have been disputed in the literature. They have simply not been incorporated into mainstream veterinary continuing education because there is no commercial incentive for any company to fund educational programs around a $2 intervention. I am not anti-pharmaceutical. Severe atopic dermatitis, autoimmune skin conditions, and bacterial pyoderma require veterinary diagnosis and often pharmaceutical treatment. But the majority of dogs presenting for chronic itching in general practice do not have those conditions. They have compromised skin barrier pH and Malassezia overgrowth, a problem that costs $2 to address. Ask your vet, what is the underlying mechanism of my dog's itching? Ask, is the skin barrier pH a factor? Ask, has a Malassezia culture been performed? The answers will tell you what category of problem you are dealing with. Full 4-week protocol. Week 1. Begin apple cider vinegar rinse twice weekly. Begin fish oil supplementation at half dose, as described in our coat health video. Week 2. Fish oil at full therapeutic dose. Continue rinse twice weekly. If skin is improving, add a dietary assessment. Identify and reduce corn and wheat in the diet, both of which drive inflammatory prostaglandin production that exacerbates skin barrier breakdown. Week 3. Continue full protocol. Begin monitoring scratching frequency. Keep a simple note on your phone, morning and evening observations. Week 4. Most dogs with mild to moderate environmental skin allergy will show 50 to 70% reduction in scratching frequency by this point. What you will observe: scratching reduces first, before visible skin improvement. The itch is the first thing to change. The appearance of the skin follows 1 to 2 weeks later. Odor improvement. Dogs with Malassezia overgrowth have a characteristic yeasty smell, particularly around the ears and paws. This resolves significantly within 2 weeks of the rinse protocol, as the yeast population normalizes. Paw licking. One of the most common manifestations of skin allergy in dogs is compulsive paw licking. This typically resolves within 3 weeks of the combined protocol. For dogs that do not respond at 8 weeks, approximately 15% of cases, this indicates a more complex underlying condition that requires veterinary allergy testing and professional management. Skin allergies are the #1 reason dogs visit a vet. They generate nearly $2 billion per year in pharmaceutical revenue, and the majority of those cases have a $2 underlying solution that the industry has no financial motivation to teach. Biscuit, the French bulldog from my opening, has now been symptom-free for 4 months. Her owner pays $2 per month for apple cider vinegar and $3 for fish oil. After 4 years and thousands of dollars in pharmaceutical management, the evidence was always there. It was just never placed in front of you. If your dog or cat is scratching right now, start this week. You have the ingredients in your kitchen, or can get them for under $5 today. Share this with one person whose pet has skin issues. Every share puts this back where it belongs. Subscribe, because what we have next is even more directly applicable than this.